Broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon, everyone. Welcome to today's webinar, and thank you for joining us. My name is Sandra Vandenberg, and I am the Associate Director at the Michael and Susan Dell Center here in Austin, and I'm also a professor at the UT School of Public Health. So today's webinar is hosted by the Michael and Susan Dell Center for Healthy Living at, again, the UT School of Public Health in Austin. And the center's mission is healthy children in a healthy world. And before we get started, I just want to make some housekeeping announcements. This webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. And then if you have any questions during the presentation, please enter them into your question chat box. Craig is going to try to answer them throughout his presentation, and we'll just see how that works. So go ahead and just put them in there, and we'll just try to do the Q&A that way. And I am very pleased to introduce Craig Gundersen, who is a ACES Distinguished Professor at the University of Illinois. And he's also the managing editor of Applied Economics Perspectives and Policy. And he will be talking about food insecurity, just in general, but also during this time of COVID-19. So thank you, Greg, and I'll hand it over to you.
Okay, great. Okay, thank you so much, Sandra. I want to begin by thanking you for inviting me to give this presentation. I really, really appreciate it. Also, thanks to the Michael and Susan Dell Center for sponsoring this. Texas is far and away my most favorite state, just an incredible state. So I'm always happy to be doing something with the good people down in Texas. So today, as the title indicates, I'm going to be talking about food insecurity. And so, you know, the good news about, one thing about COVID-19 is that it has drawn attention to the issue of food insecurity in our country. But one thing I can emphasize throughout this presentation is that food insecurity has been a big issue pre-COVID-19, and it's going to be a really important issue post-COVID-19. In fact, I would make the argument that food insecurity is the leading public health issue in terms of nutrition in the country today. I don't think anything else compares to it. So I think we need to be talking a lot more about food insecurity, and I'm going to be doing that today. One thing, you know, as Sandra noted, is that you can always put questions into the chat box. I really want to get questions throughout this, because it means if people aren't putting questions in, it means people are bored. So this is the economist style of doing things. You should please be asking questions throughout. I'm going to end promptly at 11:45, and then Sandra's going to take over. So don't wait till the end to ask questions, because then we're not going to have time. So please ask them. Okay, let's get started. Okay, so the first thing we want to do is, so we're all on the same page. I know a number of you are familiar with food insecurity. Oh, there's a lot of you there. 225 people. That's great. Anyway, is that what we want to be able to do is, some of you know about food insecurity, but perhaps some of you don't. So I want to be precise as possible about what we mean by food insecurity. And food insecurity has been on nationally representative surveys since 1996. And the way it's worked is, since 2000, we've had a consistent way of measuring this. Is there's 18 questions in something called the core food security module. Okay? And here are some examples of questions. Is the least severe of the 18 questions is, I worried whether our food would run out before we got money to buy more. Okay? The most severe, and one that's fortunately relatively uncommon in the United States, is, did the child in the household ever not eat for a full day because she couldn't afford enough food? Okay? So these questions are all posed over, you know, a certain time period. Generally, it's posed over the previous year, but sometimes it's over the past 30 days. But these are the time frames the questions are posed. The other thing about these questions is they all have something to do with limitations in food intake due to economic constraints. So, for example, if somebody's fasting for, say, religious reasons, or if somebody is, you know, always skips breakfast, this would not be included in this. In other words, it's the inability to have these meals because of economic constraint. Based upon the responses to these 18 questions, we say that a household is food insecure if they have 3 or more affirmative responses. Okay? So to emphasize about this is that it's a non-trivial hurdle. So if somebody only responds affirmatively to one of the 18 questions or two of the 18 questions, they're considered to be food insecure. So it's a relatively high hurdle to get over to be counted as food insecure. Today in my presentation I'll mainly be talking about food insecurity. Okay? In other words, 3 or more affirmative responses. There are other measures, including something called very low food secure, which occurs if there's 8 or more affirmative responses. Okay, but today I'll be talking about food insecurity. Okay. So for Feeding America, many of you are familiar with Feeding America. They're an umbrella organization for food banks in the United States. So for example, in Texas, it's headed up by a great group of people at Feeding Texas. Maybe some of you know some of the people at Feeding Texas. But anyway, this gives you a picture of food insecurity rates in the United States in 2018. We want to at least show you what's happened to food insecurity rates pre-COVID. What you can see is the good news is overall is, on average, it's roughly 1 in 8 Americans are food insecure. So that's the positive thing. What you can see from this map, though, is that there's a great deal of heterogeneity across the United States. So you see across, say, Appalachia is you're going to see higher rates of food insecurity across, the southern area, and I'm going to turn to Texas momentarily. But one of the things that I always like to point out when I'm showing this is take a state like North Dakota or South Dakota, or for that matter, Alaska or Arizona. What you see in these cases is overall relatively low rates of food insecurity, especially in North Dakota and South Dakota. But you have these pockets of really high rates of food insecurity. And that's, as you may imagine, those are American Indian reservations. So continuing high rates of food insecurity on American Indian reservations is an ongoing concern. Okay? So this gives you a picture of the food insecurity rates for the full population. This next figure then gives the rates for child food insecurity. Okay? So this is the proportion of children who are food insecure in the United States. And this, again, as you can see, is that, as might be expected, is that overall children have higher rates of food insecurity. Now, this does not mean that what this is this is the percentage of children in households that are food insecure. This is how it's being measured. Fortunately, in most cases, parents try to protect their children from food insecurity, and therefore children are shielded from this. But even the mere fact of being in a food insecure household is troubling. Roughly 1 in 6 children in the United States are in a food insecure household. Okay. Now turning to the great state of Texas, these are the food insecurity rates for the full population in Texas. And you can see is that, overall, what you see are some pockets of high rates. So for example, in the eastern part of Texas, you see these, and in particular, I'm not sure what counties these are, but you can see these high rates here. You see high rates along the Rio Bravo, and you see a smattering of high rates, in here. I'm not sure what this county is, or down here is, but you see Texas does have some real hot spots in terms of the food insecurity. The orange dots here are where food banks are located in Texas. So that gives you some sense about here. And the largest food bank in the country is in Texas. It's the Houston Food Bank. It's really an exceptional food bank. It's the largest one in the country. You can see around Austin rates are generally lower than they are in other parts of the states, which reflects the wealth of that area. So before turning to a description of what's happening with COVID-19, are there any questions or comments about what I've covered so far? Okay, then I will turn to the next slide. By the way, for any of you who are interested is that you can Google map the meal gap, which will then bring you to Feed America's website. So therefore, you can then see county by county what food insecurity rates are in Texas and in the rest of the country, if you're interested in that. So is also on the Feed America website are projections of what's going to happen due to COVID-19. Okay? Now on the left is what it was in 2018, and on the right it doesn't look as nice because it's not, I can't quite get it. It's not the same color and stuff. What you can see is that there's this dramatic shift in a lot of areas across Texas to higher rates of food insecurity. Now, this is across the board, so you're going to see a lot of areas there where, it was high before, and it's going to be high now, even higher now. But other areas, it was low before, and the proportional increase is going to be there will be roughly 17 million back. So we don't know, say, for example, during the really deep recession of 1980 and 1981, actually 1980 to 1982, what was happening during that recession or other recessions the United States has occurred. So this gives you some sense about what's going to happen in Texas that we project due to COVID-19. One cautionary note is there's a lot of information out there about food insecurity rates. I would take those with a very small grain of salt, well, maybe a medium-sized grain of salt, but not a lot. I would not put a lot of credence into those measures because in many cases there's no comparison pre-COVID to during COVID. So we want to be able to say, okay, here's using comparisons before and after COVID, what has happened, and this gives you some sense about a lot of these. Okay. Any questions about the impact of COVID-19 on food insecurity? Okay. Well, then I'm going to keep going. Okay. In thinking about then the determinants of food insecurity is, given that I'm speaking to a group of people in the public health department, is that we may think about what makes some people more or less likely to be food insecure. Okay. So in the context of COVID-19 then is, the main determinant that's causing people to be food insecure, more people to be food insecure is this: more people are unemployed, okay? Is that there's a lot more people who will be unemployed due to COVID-19, and that's why we're projecting higher rates of food insecurity, okay? One other thing about this is this notion about lower incomes, okay? While it is true that people who are poor are more likely to be food insecure, what's interesting is 70% of poor households are food secure. In other words, is that those who are poverty does not imply food insecurity, and food insecurity does not imply poverty. Okay, so it's always worthwhile to really emphasize that despite the real struggles of being poor in the United States, is most poor people are food secure. Okay, the converse of that, of course, is that roughly 15% of people with incomes above the poverty line are food. I'm not sure why that mouse keeps on moving. It's going, whoa, 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 but it shouldn't be. I'm not moving at all. Okay, so I have a question here. It says, please give a definition of food insecurity. Okay, so the food insecurity measure I gave earlier, I should have been given more details, is a household is defined as food insecure is if their food intake is deemed to be insufficient. Okay, that's the most simple way to do it. People who do not have access or the ability to access enough food to have enough food for for their families, okay? And the second part of this is, does nutrition enter into that definition? Okay, yes and no. Is that the set of questions that are posed is mainly about whether or not people are getting enough food. So there's no question about, like, are you able to eat frozen fruits and vegetables, or are you able to get enough dairy products? There's not enough of those things. It's a more general question about whether or not you have enough food. So in that sense, the answer is no, nutrition doesn't enter in. But in the sense that it does enter in is that studies have convincingly shown that those who are food insecure, on average, have lower nutrient intakes than those who are food secure. So there definitely is a connection between nutrient intakes and food insecurity. Okay. And then the other question was, do school meal programs, lunch and breakfast programs affect who is food insecure? Yes, they do. And the good news is there's been some really neat papers that have been written to show, and the school breakfast program lead to reductions in food insecurity after you're appropriately controlled for things like selection into the program and measurement error. So yes, those programs are a really critical part of the social safety net. In my presentation today, I'm not going to have time to go over those programs. Instead, I'm going to concentrate on the best program in the country today, SNAP. SNAP is amazing, supplemental nutrition program, supplemental food stamp program, best program in the United States today. So I hope that answers your question. If it doesn't, please let me know. Okay. So in thinking about some of the other determinants of food insecurity, so for example, high food prices. As I mentioned, I love Texas. One of the reasons I love Texas is you all have relatively low food prices there. I'm not sure what you're doing, but you got low food prices. So whatever H-E-B, Walmart, everybody else is doing in Texas, they're doing good work to keep food prices low. The reason why this is so important is that, you know, for those who are middle class or upper middle class or rich, is that to some extent food prices don't matter. People can purchase wherever they want. But for low-income households, even small changes in food prices can make a big difference. Fortunately, during COVID, food prices have not risen. So that's a really good news, is if during COVID-19 is that had prices increased, that would be a big deal. But fortunately, the agricultural supply chain in the United States has been remarkably resilient to COVID-19. Another reason why Texas is great is your cost of housing is much lower. Outside of Austin. You guys in Austin, you got to make a few changes. You got that crazy green belt going around your city, which drives up prices. Once you get rid of that green belt, then you're good. But you know, a city like Houston or Dallas, with a little bit more freedom. So Austin should be listening to Houston and Dallas about how you conduct your housing policy. But at any rate, is that you want to reduce housing costs because poor people spend a lot more on housing than other groups, and so you want to keep those housing prices low. Okay. The next thing is that I'm going to be talking about African American status and food insecurity momentarily in some more detail. And as I mentioned before, American Indians have higher rates of food insecurity. What's interesting is, in general, is Latinos, controlling for other factors, actually generally have lower rates of food insecurity than other groups. And we can talk more about that if we want to later. So there's also a lot of other factors that go into household structure is a big one. So for example, single parent households have food insecurity rates that are roughly, currently they're like 8 times higher than household. If a child is in a household that's headed by a single parent, their probability of being food insecure is roughly 8 times larger. So it's really a big determinant of it. Another big determinant that I'm going to turn to momentarily is this issue of disability status. Okay, another question here that somebody poses is, have you measured the level of stress on low-income families who are food insecure during COVID-19? So let me talk about that in a more general sense, is that we know that being food insecure is really a stressful experience. There's been a lot of neat research that's been done on this, is as you can imagine, parent not being able to feed their children, or somebody who just is under stress because they just can't get work or something to do this. So we would imagine then that due to the increases in food insecurity we're projecting due to COVID-19, is that there will be increases in stress due to that food insecurity, increase in food insecurity. This is along with all the other stresses that, of course, we have been enumerated with respect to COVID-19. So I don't see any evidence that food insecurity under COVID-19 is in some sense going to be worse in terms of stress than pre-COVID-19 or post-COVID-19, but there definitely is, probably other stresses related to COVID-19. Okay, so the next question is, what direct and/or indirect policies can assist in improving food insecurity? If I may, I'm going to talk about this in a little bit. The most important thing we can do to reduce food insecurity, in fact, there's nothing else comes close, is SNAP. We need to expand the Supplemental Nutrition Assistance Program. We need to keep its many, many strengths, and we need to recognize what a great program it is. And I'll come back to that momentarily. Okay. The other determinant of food insecurity is, do I still have control over? I went too fast. This is delay, I'm sorry. Okay, so there are some other things about food insecurity that also make a difference. So for example, summertime is a hard time for children. And this is because they don't have, school meals during summertime. And something similar happened during COVID when schools shut down, even though a lot of places they did have enough food, but other places they didn't. I'm actually working on a neat project with people at Urban Institute looking at some summer's meals to you and emergency meals to you. That's trying to get food to low-income households in partnership with people, the great people at Baylor. Okay, let me, there's another question up here. Great, I love all these questions. This question says, if 70% of people in poverty are food secure, are we missing people that are food insecure due to SNAP income requirements, or are the requirements adequately covering the population? I guess I would say a couple things. In terms of the first question, is yes, there's a lot of, and I'm going to talk about this later, there's a lot of non-poor people who are food insecure who would be food secure likely if they got SNAP benefits. So absolutely. So, and then are the requirements adequately covering that population? I really think SNAP, so virtually everybody who is poor in the United States qualifies for SNAP. So we're doing a good job with that population. The other thing I would say is A, we need to make sure that SNAP benefits are adequate, and B, we need to make sure that getting on the program is easy. So I want to turn to both of those when I come to that a little later. Okay, now I want to turn to an issue of race and food insecurity. I'm not sure why the slide isn't going forward. Okay, there we go. Okay, so I'm going to show why Texas is great. The first reason is look at this slide here. Across the country, we know that we have higher rates of food insecurity, okay, amongst African Americans. But one thing that is particularly glaring is in a lot of northern cities, which are highly segregated, is that you have much higher rates of food insecurity in areas with lots of African Americans. And you can see this in Cook County, which is where Chicago is, okay? What you see here is sub-county level analyses, okay? You see there that areas that are predominantly African American have much higher rates of food insecurity than areas without high proportions of African Americans. In fact, there's not a single zip code in Cook County that's 10 percentage points higher than the average that's not a majority African American. I'm going to come back to that, but first I want to answer a question here. The question asked is, how do SNAP benefits work for college students? Okay, first I'll give you the good news. The good news is college students have much lower rates of food insecurity than other groups. I mean, there's this whole college hunger issue, but that's some really poorly done work that was done by fairly mediocre researchers. So is that what we know though is that it's non-college students of similar ages that have food insecurity rates that are twice those of college students. So in other words, is the main issue in the United States is not college students suffering from food insecurity, but non-college students who are suffering from food insecurity. Nevertheless, is getting college students on SNAP would be great. SNAP recipients can receive, college students can receive SNAP, but unfortunately there's oftentimes hurdles for them to doing so. As an example is, depending upon where they live in the country, is they may have to work a certain number of hours to qualify for SNAP. But being in school doesn't count as work for some reason. So it is more difficult oftentimes for college students to get on SNAP. So we got to figure out a way to address that. But again, as college students have much lower rates of food insecurity than non-college students, especially at say UT. UT is a very wealthy school, and so on average, kids there are going to, students there are going to have low rates of food insecurity akin to what kids like University of Illinois. Okay, so another question is, how is donated food being delivered to those who are food insecure but also lack transportation, such as car or rely on transportation? So Feeding America, again, Feeding America is just a fantastic, fantastic organization. And they struggle with this a lot. You know, there's a lot of people with mobility disabilities that may have trouble getting to, say a food pantry. So there's been lots more things figured out ways to get food with those with mobility issues. Or in the case of COVID-19, is that some people may be reluctant to leave their homes, and so figured out creative ways to get food to them in these cases. So this is some of the ways that Feeding America is trying to do this. Other ways that can be trying to help with this is, with SNAP. I mean, I know this is different. You're talking about donated food there, but in terms of SNAP, is that what you see then is that you see more and more pushes to get to one more emphasis on having home delivery of food if needed for those with these challenges. And another question here, has anyone looked at food insecurity in child care center staff and school staff at schools within? To the best of my knowledge, nobody has looked at that. I mean, I know I've seen a little bit of, I guess it would depend more so on, the question is, has anyone looked at food insecurity? Okay, oh, I just said the question, sorry. Is that I would imagine that in school districts where staff are paid at similar levels to the rest of across the county. So for example, even if somebody's in a poor school and a rich school, if the pay is similar, I wouldn't imagine there would be differences in the probability of food insecurity for teachers. But is that when you look at child care workers in other contexts, oftentimes they do have low incomes and other characteristics that may lead them to be food insecure. So yes. Okay. Okay. The next question, this is great. So the next question is what are your thoughts on the 2-question food insecurity clinic screener? Is it adequate for community needs or assessments, or is it worth doing the long form? What is the benefit? So I guess here's my response is a number of you know Hillary Seligman. She's fantastic. She and I have co-authored some stuff together. She's great. Huge fan of her work. She and I have done some work looking at the 2-item screener and the advantages and disadvantages of that. So here's my take on this, is that as a screening device within clinics, I think it's fantastic, okay? Is that you're gonna get, a lot of really good information. Now, the one concern, as we talk about in our paper, is that you're gonna have a lot of false positives. A lot of people are going to respond affirmatively to 1 or 2 of the questions that are not really food insecure. To some extent, I don't care about that, is that having those type of errors, those sort of type 1 errors, is really not an issue to me, at least. Fortunately, type 2 errors are less common. So in that sense. Now, if you're doing research on this, I guess I would probably encourage you to use either the 6-item screener or if you're interested in child food insecurity, the 18-item screener. So I would encourage everybody to use that. I think it's a great screener. Okay, now let me come back to this, and I'm going to be skipping ahead of a lot of slides since there's so many great questions. It looks like I don't have control anymore. Okay, now I do. Okay, so I do. Okay, so one thing is back to this notion about that Latinos have higher rates of food insecurity. We just really don't see that, and you can see that in this picture here for Cook County. Is that while African Americans are heavily concentrated in areas with high rates of food insecurity, it just doesn't hold for majority Hispanic areas. Now I want to show you why Houston is the greatest city in the country today. Well, there's lots of reasons why Houston is the greatest city in the country today. The main reason is A, it's the most diverse city in the country. B, it has the best restaurant scene in the country today, and it's still affordable. For some reason, I can't seem to. Okay, so one great thing here at Houston is, and what you see here is that amongst African Americans is unlike Chicago, where you see this huge conglomeration of majority African American areas and high rates of food insecurity, is you don't see that in Houston. Houston is a lot more mixed city, and you don't have these heavy concentrations, even in areas like the Third Ward, things like that. Kudos to Houston. And also, you see the same thing with Hispanics. Hispanics are relatively evenly distributed throughout Harris County, which is roughly similar to what you see in Cook County, but just wanted to point that out. So, go Houston. Okay, now I'm going to skip ahead because I really want to talk about SNAP. Okay, so I'm going to skip over the issues about disability status and concentrate on SNAP. There's a lot of things in here about the health consequences associated with food insecurity, so I'm not going to talk about these, but I think the slides will be available. Food insecurity is a leading public health issue pertaining to nutrition in the United States today. Nothing else even compares to, but obesity, all this other stuff, but no, food insecurity. We got to be talking about food insecurity when we talk about health issues in the United States. Okay? And even though we're all concerned about food insecurity in and of itself, is that it also leads to higher healthcare costs. And what's been shown is that a food insecure adult has annual healthcare costs that are over $1,800 higher than a food secure adult. So we have much higher rates of food insecurity amongst healthcare costs. So even if somebody's not concerned about the negative health implications of food insecurity, I mean, all of you are concerned about that, presumably. But what's less concerned about is some of these issues pertaining to negative health outcomes. I mean, healthcare costs. So the burden is huge. We have this broken down by county for those of you who are interested. I can provide you with that. Okay. So now I want to talk about SNAP. SNAP has been a program. SNAP was formerly known as the food stamp program, now called SNAP. It's been in existence for over 50 years. Okay. What's really nice about SNAP is it's the only program that's available to people across all ages. Okay. So, and in that sense, it's become the largest, what we call the near cash program in the United States. For most all SNAP recipients are what we call inframarginal. They spend more on SNAP than they get in SNAP benefits. They spend more on food than they get in SNAP benefits, and therefore it's essentially giving them cash. Okay, so at its peak is that SNAP served about 50 million Americans. It currently is probably served, I haven't seen the most recent data, it's probably getting up there 45, 50 million people receiving SNAP, okay? And roughly half of, it depends on how measured, between 40 and 50% of Americans receive SNAP at some point in their lives. I would imagine that one of the implications from COVID-19 is that you will have a lot more people who are receiving SNAP for the first time in their lives, and therefore this proportion that people who receive SNAP at least once will increase. One other hope that with SNAP is that unfortunately there's some people in the United States that have a negative impression of SNAP. This is both people on the right and people on the left. A lot of people on the right think that people on SNAP are too lazy or something, that's why they're on SNAP. a lot of people on the left have these silly ideas about like, oh, we should tell people what they should eat with their SNAP benefits and things like that. Both of these perspectives from both the right and the left are stigmatizing of SNAP recipients, and I hope that some of those things can end. I know that there's some in the public health community, obviously nobody on this call today believes this, but who think that we should be restricting what people can purchase with SNAP. That unfortunately is one of the, overall the public health community has been not okay with SNAP, but there's a lot of people in the public health community that don't like SNAP because of that, and I hope that stigmatization ends at some point. Okay, turning to the next part of this is, I'm going to skip over this. The central goal of SNAP is to reduce food insecurity in the United States. Full stop. That's the only goal of the program. Okay? And I should say it's the only goal. Well, actually, it is the only goal. SNAP has a lot of other benefits that it provides individuals, but the main thing that it provides is security. And study after study has shown the SNAP leads reduction programs don't work at all. Okay, I can give you examples of some of those programs. SNAP is not one of those. SNAP is this extraordinarily successful program, which always makes me happy. I'm happy to be a proponent of a successful government program. It's fantastic. Okay, so the question becomes is, why does this program succeed? So I want to talk about this. Is that the first thing is it's a well-targeted program. Okay, it's a program we want. If we're going to have a government assistance programs, is we don't want benefits going to middle class and upper middle class households, right? We just want it to be going to vulnerable households. And so by this eligibility criteria, as you can see, it's really directed towards those who are most in need. Okay, so the question is how do you compare the impact of WIC, which food choices is restricted compared to SNAP? WIC is a pretty mediocre program. Now, a lot of people love WIC. I mean, what WIC basically is a infant formula program, which is great. I'm glad that millions of Americans can get infant formula to feed their children, and that's great. But if you look at WIC, you have really near universal participation amongst kids from 0 to 1 for infants. But you have this dramatic decline in participation in WIC as children get older. So you have, by the time they're 4-year-olds, you're getting like 10% of kids participating in WIC. It's just not a particularly good program, and in part because it's patronizing and condescending to low-income women. It's basically saying, we will tell you what you will and won't feed your children, as opposed to saying, let's give you, you're a responsible person. Let's give you some choices about what you feed your children. But no, WIC is really restrictive. So WIC's impact on food insecurity and other programs is much less than SNAP, in part because of these restrictions. I mean, not only the restrictions of what people can eat, but making people come in and learn about how to feed their children. I mean, once it's like the third kid, they're like, am I going to be told what again? How to feed my kids? So, I mean, WIC's fine. It doesn't, I guess it probably doesn't do harm, but it's not a particularly good program. Okay. Now coming back to SNAP, which is a good program. Okay, so the next. Okay, doesn't seem to be going. Okay, I'm trying to move this forward. Okay. Sorry about the delay on all these things. SNAP is a great program because the way it works is somebody's income is inversely, it's not showing up here, but somebody's income is somebody's SNAP benefits is inversely related to their income, okay? So back to this complaint that some people have about SNAP insofar as it discourages people from working, that's false. Is the way that the program works is that for each additional dollar that somebody has, their SNAP benefits fall by 30%. So there's a slight tax on SNAP benefits, but it's not as bad as some of these other welfare programs whereby you know, if you make $1 more than the threshold, you lose all your benefits. That really does discourage work. As an example, Medicaid is that type of program. Okay, so I have another question here. This person asks, I work at a university and food security issues among students are a significant concern. And it, again, is that I don't mean to diminish the food insecurity amongst college students. My only point is that it's much lower than the rest of the population. So I don't mean to diminish the concerns of, it's just compared to other groups, they have really low rates of food insecurity. So this is part of the thing. But nevertheless, let me turn to your question, is that, right, this was an issue in the large parts of the country, is that technically is the USDA has work requirements whereby for those who are what's called able-bodied adults without dependents, is you have to be employed at least 20 hours a week. And in a lot of cases, those requirements are waived, so would qualify. But whenever these work requirements are imposed, it means college students, unless they're working outside of 20 hours, will not be eligible. I think that this is a serious problem. As I always tell my students, is their most important job they're doing is to be doing work in the classroom. And so, you know, I think that's a problem. So I really hope that these work requirements are removed for everybody, not just for college students. I think that work requirements are really, really important. Should be waived insofar as A, SNAP doesn't reduce food insecurity. B, SNAP is an anti-hunger program. It shouldn't be encouraging people to work or anything. It doesn't make any sense to put that out. I'm having a lot of trouble moving slides forward, and I have 1 minute left. So I want to talk about one thing that's so important for SNAP, is that the great thing about SNAP, one of the reasons I love it, is it gives dignity and autonomy to recipients. Okay, so if somebody is on SNAP, is they can go to a food store and purchase the same food items that their neighbors are purchasing, that their siblings are purchasing. They're not restricted in what they can purchase, so they can purchase the culturally appropriate foods they want to purchase, the foods that are appropriate for their religious perspectives, for many other things. And it's condescending and patronizing for people to say, oh, if you get SNAP, you have to do X, Y, and Z, you can only consume these foods. So one of the main strengths of SNAP, which makes it so popular, unlike programs like WIC, is the fact that it gives dignity and autonomy to recipients. And I think we should all love a program that gives dignity and autonomy to a program. We should all love a program that reduces food insecurity. We should all love a program that's especially important in our efforts to alleviate food insecurity in the context of COVID-19. I had told Sandra and Kate that I'd be done at 11:45, and I'm going to say thank you to all of you very much. If you have questions you couldn't pose during my presentation, please feel free to contact me afterwards. Thank you again.
All right, I think that leaves the next couple minutes for me. So this is Sandra Vandenberg again. And Craig, thank you very much for a very informative and thought-provoking presentation. I like your enthusiasm. And you do love SNAP, which is great. I mean, SNAP has been very instrumental, especially, I mean, always, but especially during this time of COVID-19. So I am going to be presenting some preliminary results from our Fresh Austin COVID-19 study. And just to give you a little bit of background, the Fresh Austin study is a longitudinal study in which we're following a sample of about 400 residents who are living in low-income communities. They're going to be mostly Hispanics because that's we are Austin and we have a majority Hispanic populations in terms of minority groups. So we're studying behaviors related to food insecurity, food access, food purchasing, and food consumption. And this study is funded by the Foundation of Food and Agricultural Research and is in collaboration with the Sustainable Food Center under the leadership of Joy Kasnowski. Next slide, please. So the first Austin COVID-19 study came about when after the sheltering in place orders started here in Austin, we realized that food access obviously was changing quite a bit for everybody. But we were really interested in just kind of seeing, you know, how are people now accessing food, especially those people who may not have transportation, who may now have young children at home, et cetera, et cetera. So we asked and received some more funding from the foundation. And so we created another survey that is very much focused on concerns during this time of COVID-19, but then also, again, changes in food insecurity and then changes in how people are accessing their food. So I'll be talking just, again, this is preliminary data. We are still collecting data. We have data from about 250 people that I'll be presenting, but our recruitment is ongoing. And so we will have more complete data, hopefully in a few weeks. Next slide, please. So just to give you a little bit of an idea of who the respondents were, we have, again, like I said, about 257 people, mostly female, not a surprise, 50% Hispanics. Also not a surprise, again, given that we are recruiting people in the eastern crescent of Austin, which is more low income. We have among our whole sample about 20%, so 1 out of 5 people that only speak Spanish, and then about 16% that speak both English and Spanish. So all our recruitment materials, all our surveys, et cetera, are both in Spanish and in English. Next slide, please. So and again, I am just kind of pulling some of the interesting data that I knew would be related to what Craig was going to be talking about. So I was really interested in employment changes because, of course, we have seen that can then lead to food insecurity. So amongst our sample, we had 18% who have lost their job completely, and then 21% whose wages have been decreased. So, of course, also less access to financial expenses. And then we had 10% who replied as other, which included that other people in their household had lost jobs, etc. So if you add that together, it's almost 50% of our sample who had some kind of decrease in their financial stability, which of course, you know, could be a precursor to food insecurity. When we asked about primary concerns, and for this particular question, people could answer more than one, but we saw that about 1 out of 4 people, you know, their primary concern was becoming infected with COVID-19. But then also very high were financial concerns, food costs. And it's interesting because we did at the very beginning, when the sheltering in place started, we did go look at food costs, and we also did not see an increase in food costs, just like Craig was mentioning earlier. I'm curious to see if that has changed over time, as we have seen some of the fewer availability of meat, for example. Anyway, that's another part of our study that we'll be doing in a few weeks. But so 16% did have concerns about food costs, and another 12% had concerns about food access. Then we asked people if they had other concerns, and they could just write in their, you know, what they were feeling. And childcare, of course, came up over and over and over. But safe transportation and then distance learning for children, again, not surprising results. Next slide, please. So in terms of issues with food access, 56% of people strongly agreed that they had more issues with accessing food. So it is interesting, again, 70% agree that food is more expensive now. And I think that may have to do by the fact that people changed where they were shopping, and we'll talk about that in a little bit. But they changed their primary grocery store or primary retail establishment because they may have felt safer in another place, and it may have been closer to a house, et cetera, et cetera. But that could then explain why the food was considered more expensive now, because they were now possibly shopping at stores that were more expensive. Because what we're seeing in our other results is that people really go out of their way. They will travel further to find a store that has the cheaper food. So 58% said they're spending more money on food. 84% said it's difficult to find the food that they usually buy. So this is, again, this data has been collected over the last 2 weeks or so. So there are people that are having trouble finding the foods that they would normally buy. And then, again, what I mentioned earlier, 63% say they're now shopping at different stores. So their primary store has changed. And the reasons are that they found that there was no availability of the food they normally bought. They felt safer in the newer store. It was closer, and it was then 7% also said it was cheaper. Next slide, please. And then we also had a question about, because we're very interested on the online ordering, which is one of the things we're finding here in Texas, is that SNAP recipients can't use their benefits through online ordering. And this is something that we have been really working on with several different organizations, such as Sustainable Food Center and FarmShare, to see, what can we do to change that. But that means, that even though we're not necessarily sheltering in place anymore, I mean, it looks like the COVID-19, we may be closing back up here in Austin. So, I mean, this has just implications for a lot of different things. Next slide, please. Okay, this is what I really wanted to get to, and I know I have just a few minutes left. But so we asked questions about food. So this is using the 2-item questions that Craig talked about earlier. And so we asked how people, where they fit the, before COVID-19 and then after sheltering in place happened. And so what we're finding is that before COVID-19, we already had our group and our samples already had a high food insecurity rate. So we had 36% who were considered food insecure based on that 2-item screener. Then after or during COVID-19, that went up to about 51%, 50 to 51%. So that's quite a substantial increase. What we're also finding, and thank God for food banks, 60% of the people who used food banks to begin with were now using them quite a bit more often. So I think the food banks have done a tremendous job in providing meals for people who really need it. Next slide, please. And I just again wanted to talk about a couple things that Craig had talked about where we see the most food insecurity. So we looked at food households with children and without children. So you can see here that those who have at least one child in a household have much higher food insecurity rates than the people without children. So is 63% versus 30%, so twice as much. And then next slide, please. So again, because we saw that about 50% of people did have some kind of change in status in terms of employment, we wanted to see, how does that relate to food insecurity? And we saw, again, that if those of people who did not have any changes in employment, their food insecurity rates are much lower than those who lost a job or had their wages reduced. So this is 33% versus 73%. So again, just, these are just some of the 2 of the examples of, what we're seeing in these data. And again, these data are not complete. We are going to be collecting quite a few more weeks, and we'll hopefully do a second round, possibly in 6 weeks to 8 weeks or so, just to see, what are the longer term effects of all this. Next slide, please. So we are seeing quite a bit of increase in food insecurity here in Austin. Even though, Craig, was interesting in your slide with the counties, and Austin kind of was looking pretty good. But there obviously, I mean, there are certain pockets, even in Austin, that's considered a rich country, rich city. I mean, there's still pockets, right, where we find people, you know, too many people with food insecurity for sure. So Austin, the city of Austin has done an amazing job, I think, in putting resources into place. So the Office of Sustainability, which is part of the city of Austin, has created this website, connectatx.org, where they really are kind of like coordinating and organizing all the people who are providing resources, people who need resources, et cetera, et cetera. 211 has also been instrumental in this effort. So anybody who has a food need can call 211, and that's the number that's also being given to people when they call like if they call a food bank or call other places. That's the central location where kind of like that's where people need to go. And from then on, from there, they can get different information about where they can go to get more resources. And those of you who are in Austin or in this field, of course, you know we've had free food pickup at schools for children and caregivers. Pandemic EBT is now in place. And pandemic EBT, for those of you who don't know, is this is a program through summer, and it provides the value of school meals as a grocery voucher to eligible families when the schools are closed. And it's a little more than about $100 per child per household, so per month. So for say 3 months, $300 per kid, which is not a lot, but it's better than nothing, right? For one of the people, oh my gosh, I'm seeing it's 11:59. Here are some more resources. I know there are some questions, and I know Kate will send those to both Craig and I so we can answer them and then send this back to you. I'm sorry I went to the very last minute. Can you go to the next slide, Kate? Here's my contact information. If you have any specific questions, you can just email me as well. So I want to thank you. Sorry for closing this so quickly and so abruptly, but I noticed it's 11:59. So thank you for being here. Thank you, Craig, again for presenting for us. Any questions, please send them. You can still use the chat box or email Craig directly or email me directly. There is going to be another webinar next week, Tuesday, I believe at 12 o'clock. So I hope to see you there. Thank you very much.